Hi, sorry, my video got cut off last time, a couple of days ago, but I just wanted to get on and just finish up with that. I'm not giving medical advice, okay? Don't follow me. I only watched only 12 seasons of Grey's Anatomy. I didn't even finish the whole thing. So don't follow by my example. I was just tired and I was just like, God, if it's in your will for me to get it, then I'll get it. I'll get the transplant, the kidney transplant. If not, then I won't get it. I drank that water and I crossed my fingers. But I mean, if I needed to get it, then I would have gotten it. I mean, what can you do? So, and I knew that the doctors would not take me on Prograf because we had already discussed this several times when my kidneys were already first starting to get the damage. And they were like, if we're going to choose your lungs over your kidneys at this point, because they were just like, it's easier for us to find new kidneys for you than for us to find new lungs for you. So yeah, they were just like, we already told the doctors in Miami what to do, but we're not, they're gonna keep you on the same pills. You have to keep taking the same pills. And then if you need to do a swap with the kidneys, do what you gotta do. I don't know. But luckily everything has worked out thus far. So, and being, trying to eat more plant-based, basically, has helped a lot. I noticed that my numbers are better. I'm not completely plant-based. I still eat meat sometimes, but definitely not as much as I used to because I kind of just got used to it. But I feel like it does help. And I do notice a difference when I have been eating meat and, stuff like that. So, it's just, you take the pros and you take the cons as you will. So in year 3, we end up with COVID. My husband goes to work and he comes back. He's like, I'm not feeling too good. I'm like, okay, you need to go get tested for COVID. But he's one of those stubborn people that's like, oh, I never get a cold. I never get sick. I could run through the rain. I could roll around in the snow. I don't need to wear a jacket. He's one of those people. So he's like, oh no, it's just a cold. Doesn't matter. I'm like, you sound like you have TB or something, what's going on? Like he's coughing a lot. And I'm like, that doesn't sound normal. You're never this sick. You need to go get tested. But he's like, no, he doesn't believe me. He's like, no way. And he's not like one of those people that's like, oh, I'm not going to wear a mask, or people that are like, it's not real and stuff like that, or it's just a cold, which, if that's what works, then that's what works. But I know for us, we couldn't take any risks, So I had already been planning a family trip to Colorado. So we went along with my husband / patient zero, and we were all exposed. Luckily, nobody had to go to the hospital. But ever since then, I've had big issues with my sinuses, like really, really bad. It really messed up my sinuses. And my sense of smell is not that great, and I get a lot of headaches and migraines. So, that's kind of like, that was the beginning of starting to have issues with my sinuses and stuff like that. So around December 2022, I noticed that my jaw is hurting a lot. And I'm thinking that maybe, I need to go get checked out by the dentist. So I call his office and he's on vacation. It's the holidays. So I'm like, whatever. Called 2 weeks later. He was here the day before, but then he went back. He decided to extend his vacation. I'm like, wow, dude's been working hard. Call back and I'm like, let me give it another 2 weeks, right? Because they were like, they're going to call me. They didn't call me. I called back. And they're like, oh, yeah, the other doctor that was here, he left. But then the dentist that you're looking for, we don't know when he's coming back, but he's just taking a break right now. Which, I was kind of like, I didn't want to have to go to somebody else because he kind of already knew that, the whole immunocompromised thing. But I mean, it is what it is. I was like, you know what? Buddy's probably had a hard year, but I can't wait anymore. So I just go ahead and I get another referral from somebody else, and I go to a different office. This lady, as soon as I get there, she's like, you know what it is? You need to take out that tooth. Tooth's no good. Take out a tooth. Pain gets worse. She says, that's impossible. Why are you lying? She gives me some pills. Come back again. I'm still in pain. She's like, She's like, are you sure? Think about it. I'm like, I thought about it. It still hurts. She takes out another tooth. She's like, I think this is it. I think. That's the words that she uses. I should have known that there was something not okay. She's like, I think. Pain gets worse. It's all on my left side. If I try to touch a hair on my head, it feels like somebody's trying to rip the skin off my scalp. Like, it feels like my head is like, my brain is like inside of a pinata and somebody's just shaking it. I can feel every hair follicle. That's how bad the pain is. So I come back the third time. She's like, you know what? This tooth, I'm gonna start a root canal on it. I was trying to hold off on it till the oral surgeon was here, but they won't be here for another 2 weeks, so I'm just gonna start it for you. And then you just wait another 2 weeks, and then you just come back, bada bing, bada boom, you're gonna feel great. I'm gonna do this for you today. So she goes ahead, she does that, she drills the hole, whatever. And the pain it's worse. Like, now I can't walk. I can't walk. If I walk, I'm in searing pain. Can't touch my head. Okay? By this time, my ear, I don't hear anything in my left ear anymore. All I hear is a buzzing. I hear a buzzing and I can't hear it. It's very, very low. Like, literally, I can only hear it with my right side. I called the dentist. They're like, no, that's fine. That's fine, because it's just inflammation. It just happens. But once she gives me some antibiotics, she's like, here's some antibiotics. Here's some more pills. Knock yourself out, right? Come back. She's like, you know what? I don't know what's wrong with you. I feel like she tells me dead straight. She's like, I don't know what's wrong with you. I don't know if you're looking for pills, but I can't give you more pills. I'm like, it's not that I want pills. It's just I want to know I just want the problem to be fixed. She's like, no, she's starting to get an attitude. She's like, oh, no, we already did all this stuff. You have to wait for the oral surgeon. You can't do anything else. You just have to wait. You know, the pain is not that bad. The pain is bad. I cannot chew. You ever cried while you were eating chips? That's exactly what was going on. So, and I wasn't sleeping either. The pain was so bad. I would just be waking up. And the pills wouldn't last a long time either, probably like 30 minutes. Now, I'm not saying like my tolerance for pain is super high. I'm not saying that, but I've been through a transplant, so I know what pain is. And this was worse than when I got the transplant. And mind you, I told you that the pain pills weren't really working. That so what they were trying to give me, they had to give me they had to give me opioids and stuff. So, and then when they leaned me off, the chronic pain that I had never went away. I still have chronic pain from the surgery. So I know that it's hurting. I know that there's something wrong. So I decided to go back to another dentist that I used to go to a long time ago. And he's like, okay, whoever started this root canal did you a disservice, because you're immunocompromised, and they should have just did it once. They shouldn't have just started it and then just waited, because now they're leaving you at risk for infection. So he takes it out, gives me some antibiotics, gives me some pills. I call again. I'm like, okay, the pills are done, but the pain is still worse. You said that it would be getting better, and it's not. And I just want to know, what do you think? So he's like, you know what? I will give you some more pills, but if this doesn't get better in 2 days, I will give you a referral to go get a CT and an MRI, because it is definitely not your teeth. Something is definitely wrong. Because by now, my jaw, my ear, and my head, like everything is just hurting, especially on the left side. Like, it's super bad. So we go ahead, I do that, but I think it's the next day I go to my parents' house, and it's, mind you, the pain escalates throughout the day. So in the morning, I might feel normal, but then as I'm walking and talking more throughout the day and moving my jaw, it's getting worse. Like, the more I'm moving around, the worse it gets. So by 5, 6 o'clock, I need to just be sitting like straight and not trying to do anything extra, right? So I'm there, my mom's talking to me. It's like 5, 6 o'clock. I'm like, darn, we haven't drove back home yet, because one thing, I had to stop. I couldn't go to work anymore because I couldn't get in the car. Any vibration, any speed bumps, I felt like literally somebody was hitting my head with a hammer. Like, I could not take it. So she's talking to me. I'm just talking to her like this, with my head straight. And she's like, wait, let me see your eyes. And I'm like, just come around the table. You can see my eyes. I can't come to you. You have to come to me. Okay. She's like, what you talk about? I'm like, yeah, I can't. It's It's terrible. It's really bad. So she's like, okay, I already know what to do with you already. So she goes ahead, she tries to strap me to her little rolly chair to roll me to the car. 'Cause I can't walk anyway. At this point, I'm not fighting. Okay, I was like, at least if I go to ER, maybe they'll give me something that lasts more than 30 minutes, and maybe I might be able to sleep tonight because I hadn't been sleeping. And, I had been losing all this weight, but I mean, I'm already kind of fluffy. So when I told them that, they were like, I mean, this girl can stand to lose a couple of pounds. You know what I mean? It's not a big deal. So we do that. We get to the ER, and the doctor comes out quick. Like, I described the symptoms. At first, he's like, do you have a brain tumor? I would have led with that if I did, I told him. Definitely would have told you that first. I don't, to my knowledge. He's like, okay, well, if it's not that, then it's probably a brain bleed. I'm going to get you suited up. He's like, have you fallen? No. Were you in a fight? No. Okay, well, were you in a car crash? Nothing hit my head at all. It's hurting, right? So finally, he stops playing the guessing game. I guess he's trying to guess while they wait for the results. So they do the MRI and the CT, because I tell them, I don't want pills. Do the scans, because my dentist said that you need to do scans. So we do that. So he's like, so they see in the scan what it is, and he sees that it's an abscess, like it's a little bit of liquid behind my ear, my mastoid, by my mastoid bone, very close to my brain. So he's like, okay, so what it looks like is I'm gonna have to operate. I'm like, who are you? Whoa, buddy. We've been down this boat so many times in this hospital before. Many hospitals, that's not happening. I was like, I'm a transplant patient. He's like, oh, okay, that is true. I will need to talk to your transplant team. So then they hold me overnight. They start giving me antibiotics. They start giving me pain meds. Those are helping. At this point, guys, the next day I wake up, not only can I not hear in my left ear already, my left eye has gone this way. Like, it's cockeyed. Like, I cannot see out of it. It's completely blurry, and I can only see out of my right eye. And the doctor's like, that's normal, because with inflammation, it happens to everybody. It happened to my grandma the other day. I was like, you know what? I just got to go by whatever you guys are saying, because I don't know. I've never had this issue before. So they're like, okay, we're going to give you these antibiotics. In about 2 weeks, your eyes are going to be back to normal. I'm like, okay. And you should have your hearing back. I'm like, okay, it's just inflammation. It's just an infection, but we have to treat it with antibiotics. We have to postpone this. We can't rush into doing surgery because your doctors don't want us to do that. I was like, nah. I would assume that they wouldn't, but these days you never know. So 2 weeks passes and my eye is still abnormal. It's not normal. Can't see out of it. It's still blurry. And I'm like, well, you guys said 2 weeks, so what's going on here? And they're like, well, we're talking to some different neurologists, some different partners that we have to see what we can do about the surgery. I was like, nobody informed me. Nobody told me of this. So yeah, so that's what we're thinking about. We're also talking to different neurologists in North Carolina too, that are your transplant hospital, to see how they would handle it. And I was like, you don't have to worry about that. Just go ahead and transfer me. I'm good. Go ahead and transfer me. And he's like, well, okay, if that's what you want. At first they're saying yes, right? But every day they come with a different story. First they say yes, then they say you're not stable. Then they say yes, you are stable. Then they say, yes, you are stable enough to go on a plane. Then 2 days later, they say, no, you cannot get on a plane. Then they say, you can go by train. And then they say, no, you cannot go by train. And I asked them, can I go in the rain? And they said, no, also. So, I don't know. It just turns into a Dr. Seuss thing. And every solution that we try to come up with is like, no. But for them, they're like, you know what? Guess what? The hospital right across the street, they do transplants too, and they do lung transplants. Did you know that? I was like, oh, I know that. I don't have a good history with them, so that's why I didn't do it there. So I could tell you a million different stories of crazy stuff that has happened, right? So we just wanted a fresh start. So they're like, yeah, so they're really excited to meet you. We're just gonna get you transferred over there. I was like, no, I don't wanna go over there. Like, yeah, but your transplant doctors are now demanding that you are under the care of transplant doctors. Here's the thing. They were trying to mess with these people because They called and they said, can they take me off the immunosuppressants? You think that if they don't want to take me off the immunosuppressants for my kidneys, you think they're going to take them off of my brain now? No, man. You're wishing at this point. So they're like, no, we're not going to take her off of any immunosuppressants so that her body can fight the bacteria or the abscess. It's not even a bacteria. There's no bacteria growing. It's just liquid. So, and essentially, supposedly, they don't even know where it came from a toothache, from an ear infection. They don't know. They're not sure. So, because it's been so long and it's progressed. So they're like, well, it's very close to your brainstem, and so we're going to just transfer you across the street. And I'm like, can I just check myself out and go whenever I feel like it? No. So, back and forth. This goes on for a month. I mean, it was just very, very overwhelming. We were just there for like a month going back and forth with them, and they were really trying to convince us to go to the neighboring hospital, which we did not want to do. So after they say it will cost me $25,000 to go by plane, by boat, by helicopter, by floating cloud, I don't know. They were like, yeah, you're not leaving. And every time you come up with a way to leave, we're going to make sure that you can, because it's just not safe for you. So we have to wait for the ambulance to come get me, to take me across the street. Day one, I already knew it was going to be ghetto, because they were supposed to come get me, because I can't walk across the street, because it's literally across the street. They take 2 days to come get me by ambulance, because the ambulance is busy. So I don't even want to, it was just so much. But yeah, so they come to get us 2 or 3 days later at 3 o'clock in the morning and go to the other hospital. The whole time, the first hospital's amping me up. They're like, when you get there, it's going to be premium care. You're going to be on the ICU floor. You're going to be where the top transplant patients are, the most critical. You're going to feel safe. It's going to be like a teddy bear is hugging you. You're going to be amazing. You don't need to worry. Don't worry about COVID. We know that you're worried about it, but don't be worried about it. When we get there, I'm looking around and I'm like, this doesn't look like a transplant floor. This doesn't even look like a pulmonary floor. I don't know what this is. So I ask and I say, what kind of floor is this? She's like, it's a general floor. I'm like, okay, are they gonna take me up to a transplant floor? She's like, no, because you have COVID. I'm like, COVID? I didn't come here with COVID. She's like, you probably got it at the other hospital, so you can't go to a transplant center now. You have to stay down here with us. And I'm like, is this the COVID floor? What about the other patients? She's like, yeah, this is a general COVID floor. I was like, oh, so wait. I was over there. I was fine. I got COVID over there. Come over here. You're going to have me on the COVID floor the whole time. No, we're going to take you off the COVID floor once you test negative. The problem is that when you're immunocompromised, you can be COVID positive for months, right? So basically, I'm stuck there. Not only that, they transferred me the same night. Well, let me not say that. The next day, they're supposed to bring me my meds. They're bringing all my meds backwards. At one point, they bring me all of the meds at the same time in the afternoon. I'm like, I don't know how you guys function over here, but my meds have to be on schedule. There's certain pills that you take during certain times, and you take certain pills with other stuff. Okay, make it work. So they're like, oh yeah, listen, this is what we do with all of our patients. I was like, I ask you about what you're doing over here. I'm telling you what I'm doing, what I was doing over there that I've been doing for 3 years. So this case just gets bounced around. It's getting bounced around. And I'm just trying to get my medications. Like some days I don't even get them. Some days I don't know. You know what I mean? So, and I'm a transplant patient. I have to have my pills at a certain time and at a certain frequency, you know? So, I don't know. I keep telling the nurses, hey, can you let the doctor know something fishy's going on? Because something fishy's going on. That's all I could say. I couldn't even tell you who's lying. Because whenever the doctors come, they're like, nobody told us. And whenever I ask the nurses are like, I told the doctor. And I'm like, I don't know what cahoots is going on. I don't know what. I'm just trying to get out of here. There's bars on the windows. There's a light flickering in the hallway. I have an abscess by my brain. You might get me confused with somebody else and take me to the operating room. I don't know. I don't know. I just want to go home. But I end up there for 3 months behind the jailed. Well, yeah, it was 1 month plus 2.5 months. Yeah, with a brain infection, and they would not let me leave. And that was definitely tough. I was definitely eating my feelings. Like the lunch girl felt so bad for me that she started making me her lunch herself. Like the delivery run girl, she would actually she'd be like, oh my God, I feel so bad. Like everybody's here only here for 2 or 3 days. You've been eating the same. I'm like, I'm not eating it. So just to cheer me up, she starts like trying to be creative, come up with special things. That's how bad it is. Everybody's just like, dang man, you're young, you shouldn't be in here. The nurses are a bit strange, a little sketchy too, because every time I ask for something, sometimes they say they don't understand what I mean. I don't know, man. It was just a very, very odd situation. Like sometimes you think the grass is greener on the other side, but you notice that it's even worse. And the doctor's just trying to calm me down. He's like, listen, you're good. You're the healthiest transplant patient we have here. And I'm like, no, he said in his entire program, I'm the healthiest patient. I said, sir, that is very concerning because I have a brain infection. I need to leave. I don't want to be here anymore. So, but yeah, and then I end up going home on another 6 weeks of IV antibiotics afterwards. So it is what it is. Regardless, my hearing does not return, but my eye, as you can see, came back to normal, and I can now see in it. But my hearing doesn't come back after another 2 months. So I go up and I go to a follow-up. And he's like, you know what, I'm gonna do a hearing test just to see, what the problem is, because you should have your hearing back by now. So they're doing the hearing test, and I asked the nurse, I'm like, how's it going? She's like, I'm not supposed to say anything. I can't say anything. I'm like, well, what is it? She's like, it's not good. I'm like, oh, wow, okay. All right, so what does that mean? She's like, you're probably going to be deaf. Yeah, probably going to be deaf. Like, it's gone. I was like, okay, well, what can I do? Because at this point, I'm just kind of like, when so much stuff is happening, you're just like, whatever. I was like, can I get a hearing aid or something? Like, microphone to use? Because I can't hear anything. So she's like, yeah, we're going to set up a appointment for you to see a hearing aid specialist. So we do that. Wait 2 months, meet with the hearing aid specialist. She determines the right one. And then, went there. They ordered the hearing aid. And then I got it, right? So I was supposed to test it out for 1 month. So I came back for my month update, and they were like, well, everything seems to be working well for you. Keep going. So I go back home, but then the next day they call me, and I see the hospital keeps calling me. And I'm like, what's going on? And they're like, yeah, you're going to have to bring the hearing aids back because we thought that they were covered by your insurance, but they're not. So just come with a check for $6,000. And I was like, it's okay. Can I just bring them back? And I was like, I don't know what to do anymore. I couldn't get my pills on time. I was so relieved to find out that when I looked at my labs that they were like normal. And then now you've gone. I've been wearing these hearing aids for 1 month, and now you're telling me, you owe me $6,000, as if I'm going to just pull it out of my hat. So I just bought them the hearing aid back. So I don't know, but yeah, just pray for me that I can save enough money to hear again. We'll hear more. But yeah, overall, it's been an amazing 3 years. It could be worse. It could have been better, but it could have been way worse. So I'm just grateful for, hey, got cut off again the other day. But so I just wanted to just finish up because it kind of got cut off because I never charged my phone. Basically, what did I learn? I learned that you can't live in what ifs. I think I used to do that a lot, and I used to blame myself a lot because I was like, oh, it's my fault. I'm doing something wrong. And I used to blame myself every time something bad happened because I was like, okay, God is punishing me because of this or that or whatever. Or, maybe I forgot to scan something at Target. I don't know why this stuff keeps happening, right? So, but everything happens for a reason, you know. And because of all the things that happened, I'm like a completely different person than I was before, and it's a for the better. So it's not like, I've grown a lot more in like character, and my relationship with God has grown a lot as well. So if I hadn't gone through all that stuff, I wouldn't have, I probably wouldn't have grown as much. If it wasn't for the kidney issues, which I felt so, I don't want to say embarrassed or ashamed, but just like feeling like super guilty, like I don't know what I did wrong, like I'm, you know? So yeah, I just kind of had to like just, let that go. Started, to appreciate my doctors, my staff. Like if it wasn't for them, I wouldn't be alive. I am by sheer miracle alive because of God's grace and because of modern medicine. Otherwise, I probably would not be here. And if I was here, I'll probably still be suffering. The bright side of everything is, even with everything that has gone on, at the end of the day, I'm not scared to go to sleep. I'm not scared that I will not wake up tomorrow because I'm not breathing or, whatever. So, grass is greener, kind of. It's just a different shade of green, So you take it as you go. And, when things kind of happen like that, it's kind of like you just have to learn how to let things go. And, you can't just be like holding on to stuff. It doesn't matter, because you start to realize what's important to you and what is not, and who is there for you and who is not. And you just try to simplify everything. You know what I mean? Doctors are human. Doctors make mistakes just like the rest of us. So I can't blame them if they miss something all the time, or, if they, if things are not the way that they're supposed to be. They're human. They're doing the best that they can. I'm doing the best that I can. You know what I mean? So, they know me now. The staff knows me. Once I come in, everybody's already like, hey, we know this girl. Nursing coordinators are like, oh, what's wrong? What's going on this time? I see you every couple months, but, So yeah. And now, we, sometimes we, we found out that they would like the same boba. It's great. We have a great relationship. But definitely those 3 months earlier this year definitely was eye-opening, i.e. depressing. I don't know. But I have never been, I've been hospitalized and not able to leave the room but not for that long. Like you couldn't go in the hallway. You can't go outside because of the COVID stuff. And because, maybe the other patients have COVID. You can't even go outside and look at a tree, So it was kind of like, I just had to sit there and like, wait, I couldn't do anything. There's nothing that I could have done on my end. So yeah, when you're in that situation, you kind of just gotta go with it, But yeah, I guess, just taking it day by day, just being super grateful that things are better than they were before. And you just have different, the way I see it is before transplant, I had a set of problems. After transplant, I'm dealing with different stuff. But either way, it's still better than what it was. The good thing is though, I was able to go to find a different company, again, Google, because the hospital said that they could not help me because they said I need to come up with the money. But I found a different, audiologist, and they helped me out, and now I have a hearing aid, so now I can hear. My hearing will never be as good as it was before, but it's better than nothing. So I'm super happy about that. I like them better than the ones that I had before. These are better. I can hear really clearly, so I feel like the quality is better. So that's a major plus. But yeah, I guess like, you can't keep complaining about the same things all the time. So it's kind of, I can't like, moving has always been on our mind for a while because the healthcare system is kind of not that good. How do I know that? I went to go see my other ENT doctor, which is basically your ear, nose, throat doctor. And I was just like, first day he was like, how are you doing? I heard you were in the hospital. I was like, I almost died. He's like, where? I'm like, I'm from Miami. He's like, I know what you're talking about. Once other doctors are like, I know what you're talking about before you even say anything, that's how you know it's bad. Because he did his residency there and he was like, it's, so, but again, doctors are human. People make mistakes. And the healthcare in Florida is very much overrun. There's a lot of, elderly people. There's a lot of people with health issues. And, there's like only a small amount of specialists and help assistance for people with CF or people, with these type of surprises per se. So, I mean, moving has been undermined, but as you can see, I can't afford to step out of line. I gotta wait on God. I can't make my own plans. He has to do things the way that he wants to do things. So I just gotta go by the big guy, and that's okay with me. I have learned over time just to be patient and, just wait for an answer. So in that, I feel like I've at least grown, at least in that regard. But yeah, so that was year 3. We are now we're, in year 4. So let's see what happens next. Talk to you later. Bye.